Hey everyone, I'm Dan Weberg. I am the Executive Director for Nursing Workforce Development and Innovation at Kaiser Permanente and a author for JBL on two textbooks, one around innovation leadership as well as one on nursing practice, leading in nursing practice. I'm an ER and trauma nurse by background and did my all my doctoral work at Arizona State University and have held different executive roles across health systems in the United States, really trying to be on that bleeding edge of changing healthcare for the better and helping prepare our future leaders in ways to embrace the complexity of the healthcare system. Toxic leadership is the set of behaviors that really anyone can have. I mean, we call it toxic leadership. That can be a formal leader, that can be an informal leader, that can be someone who is an opinion leader, or someone who sort of has the ear of a group of people. And they display behaviors that are sort of dysfunctional and they cause stress, confusion, lack of clarity, and sometimes even do that on purpose. They create sort of this emotional response of teams instead of actually focusing on the work that needs to get done. Some of the behaviors that you would see from a toxic leader would be someone who fundamentally avoids all conflict. So nothing ever gets resolved. So there's a lot of stress and tension within the team that causes them to focus more on that stress and tension than actually doing the work that needs to get done or working together in a meaningful way. They have poor management of people. So, they forget the annual review cycle, or they miss that day where they're supposed to put in the bonus, or they just aren't good at coaching people through issues that happen in team dynamics. And if those behaviors happen over time, they create a lot of stress for the team in general. And so that team gets distracted and focuses more on the drama of every day than actually doing work. We have a chapter in our innovation leadership text on this, and it's one of the most talked about chapters. I do guest lectures all the time. And every time I do this with multiple schools or, talks with healthcare systems, almost everyone I talk to has had a toxic boss at some point in their career, and they can put a finger on it. And I don't even tell them the types of behaviors, the definition and stuff, and they'll point it out without prompting. And so I think it actually is a huge issue within healthcare. And it's one of those things that we don't talk about enough. I think everyone's had an experience with some sort of toxic person in their career in healthcare, and especially nurses. I think the biggest thing is we have to define it. I mean, the reason we wrote the chapter was because it was hard to put language and evidence around these behaviors. Like inherently, you knew they were disrupting the organization or the team or yourself, but we couldn't call it out. We didn't have language to just label the behaviors and be able to start addressing them. So I think that's number one. We have to sort of start understanding that dysfunctional leadership has impact on outcomes, on learner outcomes, on organizational performance. And in the clinical setting, it's been shown to increase morbidity and mortality in patients when there's a toxic manager. So people die faster when teams are experiencing this toxic behavior. So I think we have to elevate that and say, this is unacceptable. We focus in on, NCLEX pass rates or student evaluations and sort of the metrics that we have within academia. And then when we have a toxic person in our organization, well, oh, that's just how, Jerry, Sarah, Joe, whatever the name is. That's just how they are. You just got to get to know them. But fundamentally, their behavior is not acceptable and we don't address it. And so we let it fester and it causes all this drama. And that's why I think we have stress in our academic schools as well. Impactful numbers that I've seen. So 12% of the people who experience toxic leadership will quit their job. So 10% of your 12% of your team's gone under this sort of behavior. 63% of people report losing time trying to avoid that toxic person. And I personally have felt that when I had a toxic boss. I'm not going to the office today. I'm going to work from home, or I'm going to go out for that long coffee as long as they're in the office kind of thing. So 63% are avoiding that toxic person. 48% reported decreased work effort. 78% reported decreased organizational commitment. So they no longer believe in the company or the organization they're working for when they have these type of people in their team. And so, that's a lot of stuff. That's like 200 and I don't know, 30% or something of bad things happen with toxic leaders. And then on the clinical side, I don't have the specific numbers, but there are articles tying sort of transactional toxic leadership behaviors, so sort of that carrot and stick leadership, to increase mortality and morbidity in long-term care facilities. And so when there was a boss who displayed the behaviors we talked about, their patients died more often and were sicker. We get all focused on these nurse sensitive indicators, falls and infections, that kind of stuff. But there is something else that we can control in our own behavior, just leading teams, that is also causing bad outcomes in patients. And we have to fundamentally address that. We can't just sweep it under the rug. It really comes down to a couple places where you can embed this in your curriculum. So one, it's in any of the dynamics where you're working with a team. So when your students are going out to clinicals, when they're meeting with their preceptors or their clinical preceptors on the units, when you have faculty meetings and you see these behaviors, I mean, there's all kinds of ways. But I think in the education side, it doesn't have to like reside in the leadership course. And I think that's where people sort of stick it. They're like that last semester in nursing school, we'll just put it over there with all this leadership stuff that students may not be totally engaged with because it's not a ton of content onto the NCLEX and they're sort of focused on this clinical piece. But if we embed it in when they go to clinicals, when they do simulation, you can actually put in sort of these toxic behaviors. You can have a family member do that. You can have a sort of a simulated nurse manager come in and sort of treat people differently and give the students tactics to address that because they're going to 100% experience this when they get into the clinical setting in organizations, regardless of where they go. And so I think preparing them with those sort of experiences in sim and clinical and even the sort of didactic piece when they're talking about interprofessional practice and those type of things, you can embed this content in there so that they have the tools to address it, recognize it, and escalate it so that it doesn't continue to happen. When I was working at Arizona State in their sim center, we would sort of pepper this stuff in. At the time we weren't calling it toxic leadership, but we'd have sort of the angry physician call in to the middle of the simulation and demand something that was totally unreasonable and help the students sort of coach through that. We've created sort of mock scenarios where there's multiple patients and either one of their colleagues or some other sort of actor within that piece sort of trying to distract them with drama or other sort of things that pulled them away from the important work of the patient care, just so they could recognize that this stuff is subtle, that it doesn't have to be the person that's running and screaming at the top of their lungs in the middle of the meeting or something, but there's like these little micro behaviors that can kind of chip away at people over time. And so we tried to embed those in the sim. We also would do it after debriefing clinicals. We would open up the conversation and say, hey, how is the culture on the unit? How did people treat each other? Did you feel welcome? Did you feel like you were treated differently? And we'd actually have the conversations about what behaviors happen, what that looks like. And again, just allowing people to see the system and then provide them with some coping or managing behaviors so that they can deal with it as they experience it in the future. I think if you don't feel safe and content in your role and you're continually having to navigate interpersonal conflict with your team member that you have to work with every single day, it distracts from the work that you can do. It distracts from building new things. It distracts from the meaningful work that you signed up to be. Like you didn't become a nurse to deal with, a toxic boss or a dysfunctional team member. You became a nurse or a clinic professional to go take care of patients. So I think when you get distracted by stuff that isn't that core value or that core work, then it chips away at you. And I think eventually you get burned out and all the things that we're reading in the media